An 18-month-old toddler is brought to a pediatric hematologist by his father. The boy was referred to the specialist for prolonged neutropenia. He has had several blood tests that show normal hemoglobin, hematocrit, and platelet count, but an isolated low neutrophil count. He was born at 39 weeks gestation via spontaneous vaginal delivery and is currently up to date on all vaccines and meeting all developmental milestones. Today, his complete blood count with differential shows hemoglobin 15.5, platelets 300,000, neutrophils 20% bands, 2% lymphocytes, 40% monocytes, 15% so lymphocytes, and 15% monocytes. The vital signs include heart rate 90, respiratory rate 22, blood pressure 110 by 65, temperature is 37. On physical exam, he appears healthy and is within expected growth parameters for his age and sex. Bone marrow biopsy shows normal bone marrow with 95% cellularity and trilineage maturation. Flow cytometry is normal with no abnormal markers noted. Which of the following is the most probable diagnosis? Chronic benign neutropenia, chronic lymphoblastic leukemia, sepsis, aplastic anemia, and acute lymphoblastic leukemia. What is happening here is that there is deficiency of only neutrophils. All the other platelets, even the other types of WBCs and platelets are all normal here. More importantly, there is a bone marrow biopsy with bone marrow exam, which is again normal. There is 95% cellularity and there is maturation. Trilineage maturation means there are no immature cells seen on the bone marrow exam. One more thing is the flow cytometry is normal. There are no abnormal markers noted. So all in all, even there are no symptoms to suggest any pathology here. There are no other abnormalities. So this is a chronic benign neutropenia wherein there are abnormal, just not abnormal, even low count of neutrophils, and there are no disease manifestations due to this. There are no infections. It's just that there are low neutrophil counts. But again, the bone marrow is normal, so they have normal stem cells and normal pre-mature cells which are maturing normally. Neutrophils are low, and this is likely self-resolving, and neutrophils will come back to normal later on. This is just a benign finding and no treatment too. Looking at all the other options, chronic lymphoblastic leukemia is not seen in this age group. It is seen in older adults, and it will not have a normal bone marrow exam or no abnormal markers. There will be abnormal markers just in CLL. Sepsis, there is no fever, and even though the neutrophil counts are low, there are no manifestations like fever and low blood pressure to suggest sepsis and septic shock. Even there are no symptoms. The patient appears healthy overall. It is not sepsis. Aplastic anemia, I think some of you chose aplastic anemia. So, aplastic anemia, the bone marrow exam will not be normal. There will not be 95% cellularity and no trilineage maturation. In aplastic anemia, the premature cells or the precursor cells of the WBCs, platelets, and RBCs are deficient. So it is a problem with the bone marrow. So on bone marrow exam, we will see on biopsy, you classically see an empty marrow with a lot of fat cells, which indicates aplastic anemia. Again, lymphoblastic leukemia. You won't see a normal bone marrow exam, and there will be some abnormal markers seen, and I think WBC counts will increase too. Here there is neutropenia. This is a condition called chronic benign neutropenia, which is, as the name says, is benign. No treatment needed, nothing to be done. Just need to identify that that is what is occurring to avoid unnecessary treatments and tests.
Thanks for watching. Please give a thumbs up and subscribe for more.